Let's talk about daily nausea and headaches. It is a miserable combination. And I know because I dealt with it for 15 years before I finally figured out my own things. So there are actually a few simple things that you can do to try to help with some of that nausea and the daily headaches. And start managing those symptoms much better with attention to three things that I'm going to share with you in this video. And you can actually start to get them under control. Number two is actually going to take you by completely surprise. None of my patients ever knew this little tidbit, and it is a game changer when it comes to nausea. So my name is Dr. Tanya Paynter. I am a naturopathic doctor and an ex-migraine sufferer. And now I specialize in treating women with chronic migraines that don't respond well to medication to help them understand the biochemical imbalances that are contributing to their migraines and working on actually addressing those so that they can heal and move forward in their life. So let's talk a little bit about how nausea and daily headaches can be influenced by three simple things that you can do at home. All right. So why should you care? First of all, nausea is that alone can be the most miserable thing in the world, right? And then throw on top of it the migraine. A lot of times the reason behind them, the one thing that's causing the migraine is also causing the nausea. And so if we can get to the bottom of what those two symptoms have in common, it tells us a lot about the migraines themselves, right? And so you might have sometimes where migraines are accompanied by nausea and other times where nausea isn't there. Those are really important distinctions to make because that lets us know that the migraines with nausea are one type of migraine that are caused by one type of trigger, and the migraines without nausea are going to be relating to something completely different. So tracking those differences, it's not just a random thing. It's actually a very informative symptom pattern that is really important to pay attention to so that you can kind of start understanding those underlying issues, okay? So let's talk about the three different things that contribute to both those daily headaches and the nausea and what you can do about them. So number one, both of those things, the headaches and the daily nausea, is relating to something called relating to the lack of parasympathetic activity. So you may have heard me talk about this in the past. I've talked about the sympathetic parasympathetic nervous system. And basically that's the fancy way of saying fight or flight and rest and digest. So when we're under high stress, fight or flight mode, we're sympathetic dominance. That means that we're under chronic stress. When we are active in that stress mode, a lot of our body systems shut down. The things that our body doesn't need right in the moment to deal with whatever the stressor is. So the immune system gets shut down. Our body doesn't need the immune system in an acute fight or flight situation. So that goes away. Digestion. Don't need digestion if we're running away from a bear, right? We need blood in our muscles. We need our lungs and our heart to pump. We need increased blood sugar so that we can have energy for our muscles to run away, okay? Those are the things that our body deems important when we're in chronic stress mode. So when that happens, when we're in that chronic stress, when we have that sympathetic dominance, then our GI system shuts down, which means that we don't produce any stomach acid. We don't produce pancreatic enzymes. We don't produce bile salts to break down fats. So our digestion essentially shuts down. And this is a really important reason for gastroparesis, IBS symptoms, and migraines. There's actually a big link between our gut health and digestion and migraines. And so chronic stress, that's one reason why stress is such a big trigger for people with migraines. Definitely not the only reason. But our parasympathetics, our rest and digest, will allow us to improve our digestion. It's going to increase stomach acid so that when we don't have enough stomach acid, we get nauseous. And it also helps to increase our serotonin. And I've talked a billion times about serotonin and how that affects our migraines. And so one of the things that we can do besides, stress management, reducing stress triggers, all of those things, but one of the things that you can do to actually turn on the parasympathetic mode of our brain, the rest and digest piece, is engaging a nerve called the vagus nerve. So the vagus nerve is kind of the premier parasympathetic nerve. And we can actually start to target it with certain behavioral things that we can do, such as laughing, singing, humming, anything that kind of gets our vocal cords involved, because the vagus nerve run very close to the vocal cords. And so that actually can stimulate that. So that's one thing that you can do. So even though you don't necessarily feel like it, going around the house humming or singing can really help to kind of turn on that rest and digest mode. It actually helps you to relax. And meditation is another that has a ton of research that's showing that it changes our brain waves and it puts our body into that parasympathetic mode. And so that can help to improve digestion. Meditation, yes. Prayer, yes. Same kind of idea. Any type of yoga type exercises where you're just getting into those steady breathing. Breathing exercises can do that. Something else called contrast showers, where you're actually taking hot showers, like 3 minutes of a hot, warm shower, and then 30 seconds of a cold shower, and switching back and forth. And that actually will turn on the vagus nerve as well. So there's a few different things. You can also Google turning on the vagus nerve or vagus nerve exercises. And there's actually quite a few other things that you can put on there. There's some supplements that you can do. Again, I'm not going to get into all of those, but you can talk to your doctor about whether or not those would be appropriate. But any of those types of lifestyle exercise type things that you can do to start stimulating that rest and digest mode is going to be an excellent additive to your migraine treatment tool. All right, number 2. So this is the one that most of my clients have never heard of, and I'm going to wager that you haven't either unless you've heard me talk about it before. So low stomach acid, I hinted on it a minute ago. Low stomach acid is a big reason for, just totally lost my train of thought. Low stomach acid is a big reason for nausea, because when our pH is not low enough, then our body is like, well, we can't digest food right now, so we better just stay nauseous so that we don't eat until we get our stomach acid up, right? And so this can be very problematic in a couple of ways. So one, if you're on a PPI, proton pump inhibitor, or other acid blocking medications for acid reflux, this is going to be a big problem, because the lack of acid present in your stomach is going to be triggering some of that low acid, which is going to be triggering some of the nausea, as well as causing problems with your ability to digest food. So then we start looking, and there's actually been research over the last 5 or 6 years that is linking, actually maybe more than that now, time flies, but it actually links PPI and chronic acid blocking use medications with like kidney damage and malnutrition. So if you've been on it, so the current recommendation is that you are not on an acid blocker for longer than 6 weeks at a time. Now, there are going to be certain situations, ulcers or other things that you have been prescribed it for a reason and it's actively treating something that might go on longer than that, but it should not be any more than 3 or 4 months max. And I can't tell you how many people have come in to see me and they've been on acid blockers for 20 plus years. That is not the way those medications were meant. And they start to become ineffective anyway, because what ends up happening is your body is like, well, I can't have no acid. So it starts to make more and more acid cells in our stomach. And so then you have to up and up and up the medication to keep suppressing things. And then eventually they just stop working, but you can't get off of it, because then you have rebound acid reflux that's even worse than the acid reflux you started treating. So it's this big negative cycle. So if you're on an acid blocker, you first have to work on getting off of it before you can do anything else to treat this particular situation, okay? And that needs to be done with the doctor. You cannot ever just stop an acid blocking medication, or you could potentially give yourself an ulcer. It's not going to go well. So that being said, a very interesting point about acid reflux, if you were put on one or you do have issues with acid reflux, that most people don't know is that acid reflux in about 90% of cases is due to low stomach acid, hypochlorhydria, as opposed to high stomach acid, which most people think it is because you've got acid reflux. But the reason why is because when your stomach when it doesn't have enough acid, the stomach acid actually causes the sphincter that separates the esophagus from the stomach, closes off the tube that goes into the stomach. when there's not enough acid present, that sphincter won't close all the way. So then any acid that is there will just kind of bubble up and it will cause that heartburn. So if we actually increase the stomach acid, lower the pH, that sphincter will be triggered to close all the way and the acid reflux goes away. And it seems counterintuitive because we've been trained the wrong way for so long. So we actually, in 90% of the cases, we actually want to boost stomach acid in order to prevent acid reflux. I know, kind of blows your mind a little bit, right? But look into it. It's an actual thing. We've got plenty of research showing that increasing acid reflux will actually help with, no, increasing acid will actually help reduce acid reflux. All right. So anyway, that being said, if you're on a PPI or other acid blocker, do not do what I'm about to suggest because it will make things worse. You have to get off of the medication before you can try any of these acid boosting things, okay? But for anybody else who maybe has occasional acid reflux, or maybe you just don't have any acid reflux at all, but you do have a lot of nausea, is you can try doing something with bitters. So bitters are herbal extracts of a bitter herb. There's one that's called gentian. You can get it at most health food stores, like Super Supplements, I know carries some. You can get it on Amazon. So you can find it in dropper form. It tastes horrible because it's bitter. It's like super bitter, but that's the point. We stimulate those bitter receptors on our tongue, and that actually will help to trigger the whole digestive process. So you can put it in just a little bit of water if you want, but you can't hide it in something, right? Because it actually has to trigger the bitter taste buds. Otherwise, it's not doing anything. You're just taking it for no reason. A step before you consider doing that, you can look. Most people have apple cider vinegar. Or even white vinegar, although that's pretty intense, but vinegar itself is very acidic. So you can take, a teaspoon, tablespoon, give it a try. If it makes you feel better, then okay, this is an issue for me. Like if I increase my stomach acidity, then I know that I can feel better, and you can actually take a dose. If you're trying to do it when you're nauseous and you have a migraine, I would suggest going on the very low end and just making sure that, your body isn't going to reject anything, because that's a pretty potent thing that you'd be trying to take on. But you can just do, a couple drops and say, all right, how's my body adjusting to this? Seems okay. All right. You could take a little bit more. So just be very careful when you go into that. A better time to try it is, when you have maybe a little bit of nausea. Like very commonly people will wake up in the morning and feel just a little bit nauseous. And that's because, you know what? I'm not even going to get into why it is. It is the case sometimes. And so that would be maybe a better time when you're not dealing with a migraine coming on and super nauseous, just to kind of play with it a little bit and see how your body responds to it. So it's something to consider. Apple cider vinegar, white vinegar, if that's all you got, but I would more suggest the apple cider vinegar. And the other thing about that I want to say is, if you have an ulcer or history of ulcers, don't do this. You have to talk to your doctor about whether increasing your stomach acid is appropriate for you. Okay. So we definitely don't want to increase stomach acid when we're trying to decrease it for an actual physical reason. All right. And point number 3, and I've said this again a billion times, serotonin deficiency, right? So serotonin deficiency will contribute to nausea. So that's, again, an important component to pay attention to when it comes to your migraines. Are your migraines accompanied by the nausea on some cases, and then sometimes not? And that can give us a clue if it's serotonin versus if it's something else, right? So, an interesting tidbit about serotonin, one of our calming neurotransmitters. We used to think all of our neurotransmitters were made in our brain, but we have actually found since then that only about 5% of serotonin is made in the brain. The other 95% is actually made in the gut. And so this is really important. Serotonin is really important for digestion, helps to regulate digestion and the movement of our bowels and all of that. And so a lot of times, constipation and gastroparesis is actually very common, especially during migraine bouts, for this reason. And again, that can be another important clue that serotonin is a big issue for somebody that struggles with that. So, some common symptoms of serotonin deficiency: carb cravings. So if you're really craving carbs and you know that that is a prodrome to your migraine, look at serotonin, right? Fatigue and mood swings, depression, anxiety, things like that. Loss of appetite, and of course, nausea. So some of the things I've talked before ad nauseum about different supplements that you can do: 5-HTP, serotonin, or melatonin, St. John's wort. So you can look into all of those. Again, not with any serotonin boosting medications, talk to your doctor first. But what I want to focus more on that instead of harping on the same thing is what we can do from a dietary and lifestyle perspective to help boost serotonin levels. So things like being out in light, if you can tolerate that, and exercise, if you can tolerate that. Those are big triggers for a lot of people. So that might not be a good go-to for you. But some things you can do from a food standpoint, salmon is actually really helpful in boosting serotonin. Turkey and chicken is another good option if you tolerate it well. Eggs and tofu can help to boost, as well as pineapple. Spinach is another one. All of those can also be pretty common migraine triggers as well. And so again, how you respond to those foods can give us a lot of information about what's going on from the biochemistry standpoint. So if you are like, I can't eat turkey, I can't eat chicken, I can't eat eggs, I can't eat spinach, those are all issues for me. That might be a pretty common link. Like those are a lot of the high serotonin foods. So then we might be looking at, okay, what's going on there? Is it boosting it too much? Is it boosting it and then you have a sudden drop? So that's triggering you because your body's kind of up ramping. Oh, we have too much serotonin, time to decrease it. So there's a lot of kind of pieces to look into how your body responds to those. And if you eat them and you feel much better and it helps pull you out, like if you notice that you feel better after you eat those things, then that can actually give you information that, yeah, this is actually food as medicine, and I'm helping to boost my serotonin levels, and that made my migraine intensity go down. So again, paying attention to all of those symptoms that correlate with that. All right, so that's it. That comes to the end of my stuff for today. So I would like to ask if these videos are helpful for you. I've had several people reach out and let me know that it is helpful and they've been able to make a lot of changes based on some of the videos, but I'd love to hear from you too. So if you would be so kind as to drop me just a little note in the comments. I read all of them and respond to them. So I would love to hear if they're helpful for you, what you're taking away from them, anything that you'd like to have a video done on. I take requests. I'm happy to do so. So leave me a little note and let me know what you think and anything that you'd like to hear about. All right, so with that being said, stay tuned for the next video. We're going to be doing some migraine assessments from a whole body perspective. All right, see you next time.